Hi, my name is Dr. Mike Hnat. I have a dental sleep medicine practice just south of the great city of Pittsburgh, Pennsylvania. I've been asked by Airway Management to provide some feedback to them and to you regarding my personal experience using the newest of their appliances called the dreamTAP. So I've been fortunate in the last few months to provide a couple dozen of the appliances to my sleep patients, finding that it has significantly improved their breathing at nighttime and their sleep quality. But I find there to be three attractive features / improvements to this device compared to previous TAP appliances, but also to a lot of the other common appliances that we might use every day on our sleep patients. The first of these features would be, yes, we notice that the mechanism has been moved from the upper tray to the lower tray. And yes, it does increase some tongue volume. But again, really the important thing about this is that it allows the tongue to posture itself better. In other words, the best breathing at nighttime is when the tongue can position itself anteriorly, but also superiorly, right in the premaxilla area. And this pulls the base of the tongue off of the pharyngeal wall for better breathing. Secondly, another of the great features with this device is what they call the quick release feature. So this feature allows the appliance to be engaged or disengaged by the patient at their will. In other words, if they're sleeping at nighttime, they happen to awaken, they want to take a sip of water, perchance they want to converse with their bed partner, or maybe they're just a little claustrophobic, they can easily advance their lower jaw slightly forward and disengage the trays. Then again, on the other hand, they can insert the trays separately, individually, which a lot of appliances don't allow, and then they can engage the hook on the lower mechanism to the bar on the upper mechanism right in the mouth. And an advantage of this, as you know, is a lot of times if we're inserting an appliance together, whether it be a previous TAP or some of the other common appliances, we ourselves in inserting it or the patient themselves can catch their cheeks, they can catch their lips, and it's very uncomfortable and discouraging. It may actually discourage them from going forward using the appliance. Thirdly, I think one of the greatest features of this appliance is the additional lateral excursive ability, which allows the patient to move laterally, whether they're bruxing out of tension, but it does maintain their mandibular advancement position. But at the same time, most importantly, it allows the joint, the TM joints, to be very mobile. And we know that a mobile joint is a very healthy joint. In other words, when it can circulate and lubricate itself with synovial fluid during the course of the night, rather than being static in a certain setting, which a lot of the appliances really prepare the joint to be much more static, then we know that this joint is going to stay healthier while using the sleep appliance. And I find that is a great feature, really a fabulous feature to help maintain joint health while we use the appliance. Now, the proof is in the pudding for me, so I can tell you I've had a lot of reduction in AHI with my patients use the appliance, but I have made a dreamTAP in place of a TAP 3 mechanism and placed it at the same advancement position as the TAP 3. And I've had a patient who's difficult, 75 years old, older fella, less muscle tone. And what I've found is I've dropped the AHI from the diagnostic of 35 to the 18 AHI of the patient with the TAP 3 at a certain advancement. And then when I placed the dreamTAP at that same advancement, I found that the AHI even improved further, which was down to 10. So that's kind of more, to me, proof in the pudding for myself and for you that there is a significant difference based on some of the features of this device that might allow us to consider maybe using this appliance over a lot of the other appliances that we've been used. So I've found to have great experience using this device. I recommend it highly based on my experience and the improvements that I've seen with my patients. I hope this helps you in making the decision to maybe go forward and try the dreamTAP. I appreciate your time. Thank you very much.